it's nice to see you again. Your usual doctor, as you can probably tell, has retired. So even though we've spoken a few times before for various health visits, you'll just be dealing with me from now on, if that's okay. Good. Yeah, she's actually going to travel with her golden years, the best years, some say. I think she's first going to Queensland in Australia, so I'm very jealous. It's just beautiful there. Have you been? Yeah, I've been a couple of times, and it's like being in a rainforest, but you've got cities with all the modern amenities. It's just an absolutely beautiful place. So I am very jealous in some aspects, but anyone in my profession will tell you there's nothing, or any good doctor will tell you that there's nothing more rewarding than sitting with our patients and talking to them and just helping them to improve their health. So how have you been? Well, before we get on to any specific health concerns which you might have, which I'd love to hear, of course, let's do a few routine things just to get them out of the way, and then we can have a long chat. So, what do you want to do first? Blood pressure or blood test? Blood pressure. I prefer that one too, although I oddly get a bit of anxiety around both. I don't know why. You'd think I'd be used to it being a doctor. So I'm just going to wrap this around your arm, and then I'll take the reading. It's a little bit tricky to get off actually, but now I'll just wrap it around your arm. If you could just roll up your sleeves. Okay, you ready? Okay, so that's perfectly normal. That's bob on normal actually. It's 120/80. So whatever you're doing in your lifestyle, either you're very genetically lucky or you're eating right and exercising well. So if it does go a little bit higher in the future, I would say to anyone to reduce their intake of animal fats. Primarily, that's where most of us get our saturated fat from. Although I would say to any plant-based eaters to avoid all of those foods, primarily vegan cheese, which is often 100% coconut oil, which is incredibly high in saturated fat, and actually I'd ward anyone off those products. So yes, if you can stick to whole foods, whole grains, fruits, vegetables, and if you do eat animal products, then just make sure you're modulating your intake, and that will give you the best health results. And that's what all of the big kind of health bodies, charitable and non-charitable, do say mainly plant-based and small amounts of meat is fine. Personally, I choose to eat wholly plant-based, but it's everyone's choice what they decide to do. But it's just my job to try and make sure that you make the healthiest choices possible so that you can live the best quality life. But I believe you've already spoken to our resident nutritionist, so I will stop harping on about it. On the other hand, if you notice that your blood pressure gets a little low, actually a little low is fine, a little low is actually healthy, but if it's significantly low, so normal is 120/80, if it's below 90/60, then we would actually normally recommend that you increase your sodium intake. That doesn't mean eating lots of unhealthy foods, it more just means adding the right kind of salt to your cooking. So I personally prefer Himalayan rock salt, but any rock salt is fine, just not table salt, the really refined kind of light grains that clump up together like flour. You should be able to see your salt as little bits of salt. But yeah, that's only if you're below 90/60. But for now, you look completely fine, so we don't even need to worry about that. Are you ready for your blood test? Okay. I'll do this so that you don't see it. I think I'm just hyper empathetic about blood tests, even if you're completely fine with the blood test. I'm not completely fine with the blood test. I'm always okay, I just never want to see it go in, and things are usually fine. So if you just turn your head that way for me. Okay. Okay, perfect. So what we'll do with that sample is we'll send it off to the lab, where we'll check your cholesterol levels, your various levels of vitamins and minerals in your blood, whether you have any deficiencies. In the UK, vitamin D is a very common deficiency, but honestly there are so many types of deficiencies that are actually really common, so it's always worth getting a blood test done by your physician when you go to get your general health checkup. Okay, and I have just remembered something. I need to take your medical details again. I'm so sorry for the hassle, but our software for recording patient history and their medical details has been completely wiped recently, so would you mind? Thank you, you're very gracious. Okay, so can I take your full name? And your date of birth? And your height? Weight? I know this is a bit personal, but it's important so that we can, judge your BMI. Not that that's a particularly accurate measure of health, but it does give us an indicator at least, points us in the right direction. So would you feel comfortable sharing that information with us? Okay, thank you. And your address? lastly, your blood type, if you know it. Okay. That's a very useful blood type you have there. We just like to take that because occasionally we'll send reminders, and if you don't want reminders, just let me know and I'll take you off the subscription list. But we send reminders because donating blood really does save lives. My granddad actually, I can't remember if it was blood or if it was, I think it was plasma maybe. He donated so much in his lifetime, and he died just recently actually. He was almost 90. He donated so much blood plasma in his lifetime that I'm pretty sure, I could be wrong but I don't think I am, I'm pretty sure he saved the lives of more like children and babies than anyone else in the country. And he never mentioned it to me. It was only his wife, my grandmother, who told me. And he's got these plaques from the NHS or the Queen, one of those, for saving something like either 500 or 1,000 babies. It was something crazy like that because he had a rare blood type. So he gave as often as he could for his whole life basically, which is just incredible. So yeah, it's just a really incredible way for any person to make a huge difference to, you know, lots of different individuals, even if we feel powerless sometimes to change the world or make it a better place for anyone. There are lots of things you can do, so it's a really good thing to do. Okay, so let's think. I have taken your blood, we've done your blood pressure, that was all good. Computer stuff sorted, that's everything we need to do on my end. So now that's done, do you want to just catch me up with your health? Tell me if you've been having any concerns, any issues, just anything you want to talk about generally, or any questions you might have. Mm-hmm. Mm-hmm. Okay, so you say you've been having a little bit of eye pain. When was that? Okay, well, I will check your eyes right now. We should be able to check for anything mechanical, and we also get a pretty good indicator of whether there's anything wrong neurologically as well. It doesn't cover everything, so if the eye pain comes back, don't assume, if everything goes well here, that you should just brush it under the carpet. You should definitely go and see an ophthalmologist, because there's only so much I can do here. I don't have all of the tools that I would need, but when you go to an ophthalmologist, they can take photos all through the different lenses of your eye. It's actually very cool to look at. So just make sure you do that. Don't brush it under the rug if you get eye pain again. So, but let's see if we can see anything right now. Mm-hmm. Okay, well, your responsiveness to light is great. If you don't mind, I'll just take your eye. and look up and look down. Look to the right, look to the left. Okay, and the other one. Look up, look down, to the right, and to the left. Okay. Well, you've got no mechanical issues, not even a scratch or a burst blood vessel or anything like that. And just to check the responsiveness of your eyes, just to check how well they move and that there's no laziness going on, just follow my finger. Good. Okay, good. That all looks great. So, was there anything else? Okay. Well, I guess that means our time is up, and I hope to see you soon. Not too soon though, because that would suggest there's something wrong. I hope I see you at our regular 6-month checkup, and I hope until then you live healthily, happily, and that